so I tend to be a mover, so if I get away from the microphone and you can't hear me, just wave. Although I won't get too far because I can't leave the computer. So I'm going to start out with a survey, so you have to participate. I'd like to see a show of hands on how many of you were a girl who did a sport, a girl who does a sport, or, if you're a guy, you know a girl who did or does sports. So show of hands. Awesome. That's kind of what I was expecting, that all of you are probably thinking, that's me. So thanks to Title IX, the number of girls who do or did sports is rising to such astronomical numbers. It's pretty much impossible to live in our world and not be affected by one girl who does sports, especially if it's you. And we can all agree that doing sports in general is a great thing for girls. It brings them lots of active lifestyle, lifelong health benefits. In addition, they get a large variety of physical literacy benefits out of it. And if you're not familiar with what physical literacy means, it's basically fundamental movement skills related to locomotive, manipulative, and stabilization skills that kids develop throughout childhood and adolescence. The more activities they do, the more broad their physical literacy is, which is an awesome thing for them. But the problem is it's not all sunshine and butterflies for girls who do sports. And there's several downsides, which are financial stress, burnout, depression, disinterest in a sport or any other activity, inadequate physical literacy, early sports dropout, obesity, injury, chronic pain, and or systemic health dysfunction, pelvic and abdominal health problems, psychosocial stress, nutrition deficits, relative energy deficiency in sport, and or the female athlete triad, and that's just some of them. So I think that listing all that out makes me sound like one of those prescription drug commercials. We have all these great things about sports participation, but there's a whole longer list of negative things that comes along with it. And a lot of people have a lot of things to blame about why there's all these side effects about sports participation, which, by the way, don't apply just to girls, but I'm talking about girls today, and that's it. Most people blame early sport specialization. And there's a growing discussion in the sports medicine literature that absolutely confirms that. And I'll summarize the discussion for you so you don't have to go look it up yourself. Basically, the literature says that doing a variety of sports and avoiding early specialization before age 13, so that's middle school, that's the best choice for overall health for athletes. But what about the people who are going to play in college or go pro? The literature says that if they have that potential, and this is about 1% of girls, then specialization is probably the best bet for the girl, provided that she does it correctly. And there's a lot of literature on how to do it correctly as well. So we won't have the debate here on which one's better, but we definitely know that we have reasons to support specialization or what we'll call diversification. But I think we actually need to address the elephant in the room, which is why are so many kids specializing early, i.e. before age 13, and why are there all of these side effects? So most people in here might be thinking this. Everyone wants to place the blame somewhere, and usually the story is, for the blame, is that parents or coaches pressure kids to specialize because of their own unrealistic or unrealized dreams. Some of you are probably thinking, yeah, I probably think that most of the time, myself included. I'm not saying that those parents and coaches don't exist, because they do, but it turns out that for a majority of young athletes, the literature says that this is not even close to the truth. There's a little known, little talked about catch-22 reason at play as to why kids specialize early. In most sports, they have to specialize early in order to be included at all, later in childhood and adolescence. The problem is, once they specialize early, they are at risk for all of those side effects that I listed. Oh, this is going to be fun. Okay. Bear with me. Sorry about that. Okay. So for example, let me give you a sort of case scenario. In order to make the 6th grade soccer team in a metro Atlanta middle school, girls have to have specialized in soccer before age 11. Now, that's not required on the entry form, but that's pretty much what it's required to make the team. So if a girl doesn't specialize, she won't make the team, at which point she has a few options from which to choose so that she can remain active. Option 1, she could join a less competitive recreational team. This is assuming there's enough of those in her area and there's funding to support it. The team will be lower than her ability level, therefore won't motivate her to improve, so she'll probably drop out from that eventually. There's option 2, which you guys are probably all thinking of. Oh, I got the answer. She could join another sport, right? She could, but the problem is that so many other sports require early specialization in order to participate by middle school. Plus, I mentioned physical literacy. If she specialized in a sport early but didn't make the team, she's probably going to be lacking certain fundamental motor skills in order to participate in other sports. Let's say she goes from soccer to swimming. She may not be a good swimmer. So she will have missed the boat for certain sports, in which case she'll probably drop out. And that leaves us with option 3. So she could save herself and her parents the emotional and financial stress of even giving options 1 and 2 a try, and she could just drop out from the get-go. So this is one reason why 7 in 10 girls drop out of all sports participation by age 13. Again, that's middle school. They and their parents, even with the best and most healthy intentions, face the pressure to specialize with few or no other options. And facing these options is really hard for a middle schooler and a parent. I don't know if any of you guys have been to middle school lately, but I work with them all the time. And I can say what middle schooler wants to be known as a quitter. Who wants to be known as a quitter, truly? And in middle school translation language, quitter means you're totally not cool, you won't have friends, and you won't have purpose in life. So they're faced with the idea of, am I going to be the quitter, who is horrible, horrible person, or do I stick with it and be miserable? So unfortunately, many girls, 7 in 10 after all, choose option 3, drop out. And they end up a complete mess because of how much it stinks for them. They may end up depressed, develop disordered eating, develop poor health habits, and miss out on the positive value of being part of a team. Poor health habits could turn into a problem on the total opposite end of the spectrum from specialization in sports, which is childhood obesity. And all of this could result in a lifetime of health consequences, and all of it is preventable. So not only are our middle school girl athletes faced with dilemmas about whether to specialize or not, but there's also more complex reasons why they may have so many negative consequences for specialization. Part of it is they're amidst an extremely dynamic and plastic stage in their lives, which lasts at least a decade. During this decade, a girl's growth spurt begins, usually around age 9, where her bones grow fast and her muscles literally can't keep up with how fast she's growing. Add on top of that her neuromotor development. From ages 8 to 13, neurons and nerves that live in the brain and spinal cord must adapt and recalibrate to a girl's physical growth. The tween girl is literally rewiring, or perhaps wiring for the first time, complex motor patterns that she'll carry with her for the remainder of her life. Because of all this plastic change, it's a time of both extremely high injury risk in our athletes, or a time of great opportunity to redirect her course, in other words, through injury prevention and rehab. If she specializes early and thus limits her wiring of certain fundamental motor activities, though, she may pass through this time and never truly master certain skills. That's me we're talking about. So I specialized in swimming at age 8, and now I have a tough time as what I call a land mammal. We're doing really good with me standing here. This is why I still run into walls, did it this morning, and trip almost every time I stand up. So put me in the water, and I'm totally good to go, though. So I'm great in the water, terrible on land. So like me, if a girl aged 8 to 13 has an injury, specializes, or doesn't have the proper rest, recovery, and rehab, this could lead to problems throughout adolescence and adulthood. And like a good PT talk, we could spend hours diving into the grave details of the physical and neuromotor changes that occur in growth spurts, and believe me, I love to talk about that. But it's important to understand that there's a lot more than physical and neuromotor stuff that's going on in this decade, a decade that I like to call the perfect storm. Girl athletes are also reaching menarche, or the start of their periods, and laying groundwork for pelvic and abdominal health function later in life. And guess what? Physical, neuromotor, pelvic, abdominal, and menstrual health and sports performance are all related. Sorry, I'm not logging into the Wi-Fi. Okay, so case in point, let me give you an example. Evidence tells us that high school female athletes with menstrual regularity are 3 times more likely than girls with normal menstruation to sustain an injury severe enough that results in at least a week or more loss of time from their sport. So they're sitting out of their sport. They're possibly getting physical therapy if we're lucky. And if she does get a great PT, it's likely that even the best PT, who's limited by reimbursement and productivity demands, is unable to consider more than traditional physical or neuromotor aspects of a girl's care, right? So it's unlikely anyone's doing anything about the menstrual regularity for sure, assuming they've even asked about it. So her menstrual regularity clues us into an underlying problem for our active girls, especially the specialists, which is rooted in the female athlete triad. The triad is an extremely well-documented phenomenon in the literature and occurs in females due to a relative deficiency in energy. The reason why this is so pertinent to our tweens and teens is because they're growing, and the effects of low energy are even greater because their bodies require extra energy for normal growth and development. And oh, by the way, these tweens and teens have specialized in sports, are taking harder classes at school, forming more complex social relationships, and are getting involved in other community activities. So you can see what I mean about perfect storm. So for these middle school girls, a relative energy deficiency can lead to impaired bone health, menstrual function, and fractures, stress fractures. So that's what the female athlete triad is made of. Sometimes this is intentional, and we can classify them in a disordered eating type of classification. But most of the time, it's totally not intentional. They're just extremely overprogrammed, and their energy is overutilized compared to how much energy they're taking in and storing or recovering from during their growth spurts. But for our growing girls, we really have to look beyond bone health and menstruation. A newer term, relative energy deficiency in sport, was coined in 2014 in the literature and classifies this phenomenon more broadly related to other body systems that may be affected in both girls and boys. So we're not going to totally forget them. This may include areas that the triad mentioned before, with the exception of menstruation in boys for obvious reasons, in addition to protein synthesis, cardiovascular, psychological, metabolic, and endocrine function, anemia, and overall sport and athletic performance. So it takes the triad, and you can see it's part of the whole picture. We're not saying the triad's not included, though. So it's extremely vital for an athlete's long-term health that we monitor her energy intake and expenditure, right? Which sounds really easy, but it really isn't, especially in our growing girls. Especially according to the literature, they say this is hard to do directly by way of a food diary or by literally monitoring how much energy she has. So to me, especially in a girl who's reached puberty, the easiest way to monitor her energy deficiency or her amount of energy is through her menstrual function, since we know they're related. So we're going to talk a little bit more about that. So when girls are getting the birds and bees talk, perhaps parents, or whoever's giving it to them, health classes, assuming they even have health class at school, need to be teaching more about how babies are made and what periods consist of. That is, of course, assuming that these adults know all of the secrets. So girls start to specialize in sports long before middle school when they're growing, and starting their periods even before they get the birds and bees talk around age 9. So we have to teach proper health practices even earlier, while righting the wrongs that girls and adults are reinforcing already. Evidence shows that girls often mistakenly believe that skipping their periods makes you a better athlete because you're training harder and losing weight. They can easily see the correlation there. Girls are also under pressure from adults, friends, and our culture for certain body types and eating habits, and there are so many conversations we could have about that. So as a result, they'll have an energy deficiency, and the endless cycle, pun intended, gets reinforced. So tracking their cycles is absolutely a start. There's simple and useful resources to help kids track this, like apps, and apps are super awesome. Kids love them, but there's more to it than just tracking. A female's hormone levels vary normally during different parts of her cycle and have a strong relationship to sports performance. So this is where it gets cool. So it's normal to have an energy spike during ovulation and an energy crush just prior to menstruation and during. Also, due to normal hormonal fluctuations, injuries are more likely prior to and during a period. So wouldn't it be totally cool if we could plan training, recovery, and competition around these natural cyclic patterns in the female cycle? I think that's a little wishful thinking, but then again, having the knowledge will clue her in and us into how to care for her holistically. It's also a great conversation to have with parents. So while we're on the topic of menstruation and pelvic health, it's important to discuss how a girl's pelvic and spinal growth affects her core development, specifically her pelvic floor muscles. So like other neuromuscular changes, her core and pelvic floor muscles are rewiring, or wiring for the first time, their function during puberty and adolescence. We usually think of pelvic floor problems as an adult issue related to pregnancy, postpartum, or menopause, and it is. But tons of nulliparous women, i.e. those that have never been pregnant or delivered a child, which by the way includes teens and kids, they have pelvic pain, pelvic floor dysfunction, abdominal, urinary, and bowel problems. And guess what? Guess when these active females started to form bad habits that led to these problems? Childhood and adolescence. But who's talking about pelvic floor problems in kids and teens? Just a few people, but not too many. We know that there's a high prevalence of stress urinary incontinence, or SUI, in adolescent female soccer players, adolescent female tumblers, and a higher incidence of SUI in adult female athletes who had it as a child or adolescent athlete. And we know that SUI is not an injury per se, but an indication of an imbalance in the deep core muscles. We also know that the older a teen girl is, and the earlier she specializes and overtrains, she's at greater risk for stress urinary incontinence, which sounds an awful lot like the risk factors for severe injury in the female athlete triad or REDS. We know that the greatest predictor of SUI is constipation, and 30 to 50% of kids are constipated with secondary leakage. So guess when constipation usually begins for our young girl athletes? We have to trace it backwards even further, into childhood and potty training. This was probably the last time that adults paid attention to a girl's bowel and bladder habits when she was transitioning from diapers into being a fully continent child. So who's paying attention to her when she's perhaps the most vulnerable in puberty, adolescence? Remember how I said that teenage girls would probably be mortified at the thought of being a quitter? Just imagine if she's leaking urine or she's extremely constipated. She's probably developing some bad habits to control this, which more than likely are actually worsening the problem. And you better believe she's totally not telling anyone about it. She may quit her sport because of it. And she will become that adult woman who pees when she sneezes, laughs, or coughs. She'll think it's normal, there's nothing she can do about it, and so she won't talk about it. But who says we can't prevent this? So this is where you come in. If you work directly with the young female athlete at any age, in any context, whether you like it or know it or not, you directly affect the development of her pelvic health, sports performance, and later integrative women's health factors. And maybe you don't specialize in pediatric sports or pelvic and women's health like me, but that doesn't exempt you from making a difference. In any setting, knowing how all of these systems work together will help any girl athlete. So let's take a fairly well-discussed girl athlete topic and put it all together for you. So we know, it's very well understood now, that girls are at a higher risk than boys for non-contact ACL injuries. And there are many, many valuable evidence-based ACL injury prevention programs out there to address this, and I love them all. But I believe we can take our evidence one step further. We know that early imbalances in core and pelvic floor growth and development are related to constipation and SUI. We know these same core and pelvic floor imbalances put our girls at risk for ACL injury. Layer on top of that your new knowledge that irregular menstrual cycles put girls at risk for severe injury and sport dropout. Apply the evidence that girls are more susceptible to injury prior to and during menstruation. Accept the fact that most girls may just have to specialize early in order to participate in sports at all, and they're going to have an energy deficiency because of it. Realize that these specialists have that energy deficiency in a time when they need energy the most to grow and develop normally. And now imagine if we could combine all of this information and customize an integrative ACL injury prevention program that moves beyond teaching girls exercises. So there's not a quick fix or a way, here's my ACL picture. There's not a quick fix or a way to do this for ACL injuries and all of the problems we see in girl athletes, but we've made some strides. We formed a team of student researchers along with pediatric primary care sports medicine physicians that are performing groundbreaking research to screen for, prevent, and educate on all integrative health factors before, during, and after these perfect storm periods in a girl athlete's life. So stay tuned on that. For any girl, puberty and adolescence can be that perfect storm, or we could look at it as an amazing opportunity to steer our girls on the most inspirational, empowered paths into adolescence and adulthood. All right. But I have to ask the question, how many of us are missing out on these amazing opportunities to steer her path? I challenge you with the question, how many of you are routinely and compassionately asking girls about training habits and schedule, involuntary urinary leakage, constipation, menstrual health, dietary practices, sleep, and psychosocial problems? So we hold the power as direct access providers to screen for this and steer our girls on the right path, even if we don't take care of it ourselves. But wait a minute, before you go asking unsuspecting middle and high school girls a bunch of personal questions, there's just one more thing. Changing a girl's path doesn't start with the girl. With a girl or teen comes an entire dynamic family and community. Research shows that most issues in a child's health are related to a parent's health practices or factors, whether genetic or learned. So we can't go at it alone. We must be willing to be vulnerable, ask for help, and spearhead a wellness team for our girls and her family members. We also need to keep an eye out for girls who do not want to specialize in or even play sports at all. There's a lot of them. They need alternatives that keep them active so they don't end up on the other end of the activity spectrum with childhood obesity type problems. The good news is that less competitive sports and activity clubs are slowly growing in popularity, but we do have a long way to go to make these more available, popular, and inclusive of multiple populations. So we can't do it all at once, and it takes time to create changes, but I believe that the conversation starts between two people. Eventually, these small conversations may grow into a larger conversation. So kids and teens love gossip. So if you're not sure about how to spread information, just ask them for advice. And by gossiping about this, we can help our girls through childhood and adolescence as healthy, resilient, self-confident, self-sufficient, and passionate advocates not only for their own health, but also for their teammates' health and the health and wellness of generations of girls to come. So I expect you to get out there and start gossiping. Thank you.